Hello, I am Dr. Chandrika. Pregnancy symptoms and pregnancy tests. These are two terms apart, okay? See, pregnancy symptoms is produced because of the occurrence of pregnancy, and this is due to the hormone of pregnancy. That is the human chorionic gonadotropin. HCG is the hormone of pregnancy, because of the occurrence of which the symptoms are produced. So, the symptoms production is different in different individuals. See, there are some people who are very sensitive. Their body immediately recognizes even a small amount of human chorionic gonadotropin or pregnancy hormone. If it is just produced, they will immediately be sensitive to it, and so they will have symptoms of pregnancy. But there are some people who are not so sensitive, so they will not have symptoms. So the reason for the symptoms being there and pregnancy not being positive is the main reason is that it is a very early case of pregnancy in which that pregnancy has not reached such a stage wherein the hormone level has increased to such an extent that it will show pregnancy test positive. So these are the reason that some people will have symptoms and they will not have pregnancy test as positive. So in such cases, if you allow them to advance a little more in pregnancy and then do the test, then definitely their test will also show positive when the symptoms are there. So that is the reason some people have symptoms and they don't have positive pregnancy tests. Stop pregnancy bleeding in the first trimester. This is not this thing that the patient can do. What is the thing in first trimester is the first 3 months of pregnancy. That is the time when so many times bleeding can happen. The reason for that is the body of the women is getting adjusted to the new thing in the uterus. So when it gets implanted in the uterus, maybe some amount of bleeding because it is not getting properly implanted. And sometimes it may be due to various factors. It depends on the factor that is causing the bleeding, which the doctor will come to know if you visit her whenever there is a bleeding. And the most commonest modality we use is ultrasound. By ultrasound, we can make out whether the healthy pregnancy is progressing or there is some problem with the pregnancy. So depending on what the problem is, we handle it and we just give the treatment to the patient. Means we try to give different methods of medicines and injections by which we are going to support the pregnancy with its various hormones, and that way we try to avoid the abortion in the pregnancy. And sometimes it can happen due to looseness of the mouth of the uterus. And depending on our ultrasound findings, we take action and we just thus try to prevent the bleeding in the early pregnancy. In early pregnancy, nausea is a very common factor, and this is individualistic. Not that all patients will have nausea. Some people will never have anything and they will not know any symptom and they pass off pregnancy so smoothly. But there are some individuals who have too much of nausea. That is depending on their nature, and most commonest cause of this nausea and vomiting is gastritis. Gastritis is known to increase during pregnancy. So we have to tell the patients that you have to keep eating something frequently, because if you have empty stomach, the acid that is produced in the stomach will give rise to irritation in the stomach and hence the vomiting and nausea. So to avoid this one thing is frequently eating something. Other than that, foods that we recommend is ginger is known to be natural substance which tries to avoid nausea, and nowadays they have that ginger with sugar, that is what is called as morabba in our south. Those things if you are chewing, so that time also you can avoid nausea. And most important thing is avoid empty stomach. So keep taking something which you crave for, not anything by force. So what you crave for you eat, so that when you crave for and you eat, vomiting sensation will be less and you will get that one digested. And one of the commonest thing that I recommend again is tender coconut. Tender coconut is a very clear liquid and it contains some electrolytes as also some glucose. So it will take care of nutrition and also the electrolytes. So that one if you take sips of tender coconut every now and then, that time you can avoid exhaustion and tiredness also. This is how we can get over the nausea that occurs in the early pregnancy. Fibroids passing out of fibroids bleeding. This is not a very common thing because nowadays incidence of fibroids have increased like anything, and fibroids doesn't bleed so easily and fibroids doesn't rupture also so easily. It is a very rare phenomenon. See, sometimes very rarely it happens, and if it ruptures, it can happen, and if it ruptures, the uterus is inside the abdomen and what the fibroids are there on the surface of the uterus. If it ruptures, when it ruptures, it will start bleeding, and when that bleeding happens, the blood will start accumulating in the general abdominal cavity, and the independent part of the blood will be in the pelvic area. So when the fibroid ruptures, what symptoms we can get is the patient can go in for a severe abdominal pain. And if she develops such abdominal pain, she has to go to her doctor so that the doctor will be able to diagnose the problem. There are so many causes for acute abdomen. It is called acute abdomen because it is an emergency and it has to be handled immediately. So the doctor whom you go will try to get different modalities like CT scan, ultrasonography, and then she'll come to know that fibroid has burst. And if fibroid is burst, we need laparotomy and procedure depending on the need. That will be handled like that. Menopause is nothing but stoppage of menses, and if the menses stop for a period of 1 year, then the lady is supposed to have menopause. But because still 1 year we give so that sometimes they may get infrequent menstruation and still it is not called menopause. So once they pass 1 year without any menstruation, then they are supposed to have attained menopause. So what we have to do after menopause is, so many symptoms come when menopause happens, because the menopause is nothing but cessation of the cyclical hormones produced by the ovaries, and our body is used to those hormones which is coming cyclically, and suddenly when there is no hormone, they may feel very peculiar. So many things that can happen is, they may have hot flushes, they may have cold sweats, they may have sleeplessness, they may have depression. Generally they will be aging, and because of aging also their physical ability will also reduce. And one of the commonest things that we see is, after menopause, most of the ladies tend to put on weight. So we have to be always careful about our lifestyle, and whatever it is, we should not eat as we used to eat in our younger days, because the metabolism will be different when we are younger, and when we become old, the metabolism will become low. So because of that, if we start eating as we were eating before only, we tend to put on weight. And once we put on weight, we are going to develop all the problems of health that we come across. See, one of the things is obesity is the cause for onset of diabetes, onset of BP, and onset of so many physical things. Means simple thing is, routine walking also becomes a problem if you become obese. So these are the things we have to be careful. And some of the mental things that happens in menopause, we can get over by making ourselves busy in our life, so that we'll not be always thinking that we have attained menopause. So most important thing is, you have to maintain your lifestyle in such a way that you remain healthy. Labor is really an intense physical activity. First thing is, the lady should make up her mind that she is going to deliver. So as an obstetrician, we have to tell them that if you are going for a normal delivery, first thing is you have to make up your mind that I will face that problems of delivery and I'll try to get over it, and so I can deliver normally. That is one thing she has to make up in her mind. And other than that, as it is a really exhaustive situation, so that because it is a big physical activity, they try to go have dehydration, and their physical ability also sometimes reduces. So for that, we have to provide some support around the laboring lady, so that they will be trying to encourage her when she gets disheartened, and they try to buck up her mental status. And one more thing is, most common thing is dehydration. So to prevent dehydration, we have to keep giving them some liquids, most of the time liquids with electrolytes. So one of the most good natural things that is available is tender coconut. So I tell my labor patients to keep taking sips of tender coconut now and then, so that her exhaustion will be reduced. Other than that, whatever she eats, we should not allow them to eat very heavy food stuff. So they have to take more of liquid form and more with electrolytes. That is the thing we would tell them to get over the exhaustion that happens in labor. And sometimes question says, mother may not be able to push the baby out, because pushing the baby is this thing that she has to cooperate. And if she is not able to cooperate, only thing is, depending on the position of the baby, if it is quite down, we can help her by pulling from down, and that is nothing but vacuum extraction or forceps extraction. This will happen only if the baby has descended down to a certain extent. If it is too high, it is not good to use these methods, because it is dangerous for the baby. It may get damaged. So if there is no way that she cannot push, the only thing, we have to have a safe period, and if it is not going to allow by vacuum or forceps, then we have to go for cesarean section.